Hi, my name is Jerry, and I'm going to be talking to you today about prior authorizations. Now, a prior authorization is needed typically when a patient is going to be needing any kind of a medical procedure, dental procedure, or even a medication. And with that, it could be anesthesia, x-ray, surgical procedure, or an outpatient, inpatient or outpatient type thing where it's going to need to get approval prior to them having the procedure or medication. So on the prior authorization, it is very important to make sure that all the information on there is correct and accurate. With that being said, I'm saying the patient's name, the patient's date of birth, the policy holder. Is the patient the policy holder, or is it a spouse, parent, or guardian? You want to make sure that that information is accurate as well. And who the employer is. Who is the insurance through? If it's mom, who's mom's employer? Or if it's dad, who's the employer where they're employed through? Another bit of information that is going to be needed on there is the diagnosis code and the CPT codes. Those are what the insurance is going to look at to see, okay, why is this being covered? Why is this needed? On those procedure codes, they are going to be asking, what has the patient tried and failed? They are unlikely going to want to pay for procedures or medications that are costly when the patient has not tried smaller procedures, cheaper medications, or anything like that before this other bigger, larger medication procedure. Anything like that is going to be covered. So when you're sending over the prior authorization, it is very important to make sure that all that information is being sent over there as well. Now, once this information is sent over there, they usually can take a few days, depending on circumstances. Generally speaking, if something is like an emergent situation and there is no time for anything to be done, if there was a car accident and the patient needed to be rushed into surgery, certainly it's not going to be pre-approved, but because it is an emergency situation, things can be dealt with later. Now, when they're sent over there, the waiting game usually takes a couple days. I have seen medications take up to a couple weeks depending on what kind of medication it is. Injectables can take a lot longer depending on what the diagnosis is, and if the patient has tried and failed things, topicals, light treatments, stuff like that before, an insurance company may want to pay for an injectable treatment for their psoriasis. Now, with that being said, once the information is sent over to the insurance company, we wait to hear back. Now, it is also very important to keep the patient in the loop when doing these. The last thing you want to do is have a patient not hear from you, the provider, or a staff member from the provider's office, and have them get a letter in the mail stating that his or her medical procedure or medication is covered or not covered, because then the patient's like, well, why haven't I heard? Well, it's always important to keep contact with them, make sure that they feel important and they are being looked after. Now, if prior authorization is in fact denied, there are reasons why that could be involved with that and why it was denied. It could be an error on handwriting or anything like that. That's why you always want to double check to make sure all the proper information is sent over there. Demographics, patient, date of birth, all that kind of stuff. Diagnosis code. Now, one of the biggest things for denial could be the patient has not met the certain standards that needs to be kept. With that being said, they did not try all the medications necessary for stuff to be covered, or it's not a medical necessity. The insurance company doesn't feel like it's a necessity for the patient. They want them to try other things prior to them doing this coverage. And so that's why it is always very important to make sure that you are on the same page with the patient, provider, and the insurance company, because in the end, what we really want to do is make sure that our patients are getting the utmost care, not only from us, the provider, and the medical team that is trying to help them, but the insurance company as well. And one more thing in ending that is that even though that a prior authorization may be covered, it doesn't guarantee payment of the actual procedure until the claim has gone through. So that can be very confusing for patients. So it is very important to reiterate that to them, that even though that it is approved, that it may not be covered in the end. Thank you.